The KwaZulu-Natal Premier Sihle Zikalala is giving us details on the province's vaccine rollout plan. Sihle Zikalala will also explain the latest trends and analysis the COVID-19 pandemic is having on the province. It has started. Let's take you there now live.
The Republic, His Excellency President Cyril Ramaphosa, and the National Command Council for the leadership they have continued to provide as we navigate the health crisis of unimaginable proportion. Ahead of the first confirmed case in South Africa on the 5th of March 2020, the President and the Cabinet have provided strong leadership in tackling COVID-19. They have always shown exemplary leadership and courage during some of the most difficult times that we have seen. We welcome the pronouncement by the President, and more especially the decision to ease some of the restrictions while sustaining the country on adjusted level 3. We have cause for optimism. With regard to the arrival of the vaccine, we take this as a historic moment, as yesterday we witnessed the arrival of the Oxford University AstraZeneca vaccine from India into South African shores. As the province which had the first case of COVID-19 in the country, we are extremely delighted to be part of this giant leap by humanity, which marked the beginning of our march toward the victory against this deadly virus. This is a solemn moment to pause and reflect on the devastation that has been caused by COVID-19 in our lives, and to remember all our loved ones who have sadly left us due to this virus since March 2020. We extend our heartfelt appreciation and thank the people and the government of India for the solidarity and support. Because of them, for the first time ever, we can now boldly say that we have an even stronger and more direct line of defense against the virus. To complement the non-pharmaceutical and therapeutic treatment interventions that have been relied on heavily in the past, which must still be continued and not be abandoned. With regard to KZN plan to roll out the vaccine, as the province of KwaZulu-Natal, we have developed our own vaccination rollout plan based on guidelines set by the World Health Organization and the National Department of Health. Our plan focuses on the management, distribution, and dispensing of the vaccine. The province has established a vaccine coordinating committee, which includes private sector, hospitals, traditional leaders, eThekwini municipality, health systems trust, organized labor, NGOs, especially the PEPFAR, which has always been our partner, the academic sector, the National Health Laboratory Services, the civil society, and the South African Military Health Services, among others. The Provincial Vaccine Coordinating Committee is chaired by the HOD for the Department of Health, Dr. Shabalala. Across the province, all our districts have finalized vaccination distribution plans. We have pillars of the vaccination plan, and this starts by ensuring governance and coordination. The Provincial Command Council will support, monitor, and perform oversight over the vaccination process, especially the rollout. We have phases as cascading from the national plan. And phase 1 is divided into 2, that is focusing on staff in direct contact with patients, and these are healthcare workers and support staff. 2, staff not in direct contact with patients, and these are administrative and other staff members. The provincial first beneficiaries are targeted as follows. 1, the public sector healthcare staff, which is about 67,644. Medical doctors, dentists, pharmacists, emergency medical services, and all of them are around 9,292. Interns are around 390. Nurses, 34,279. Non-OSD staff, 20,417. Allied health professionals, 2,639. Engineers, artisans, 366. Staff providing social services, 256. Privately contracted staff working in public sector, 14,625. Traditional healers, 5,939. Military healthcare staff, 350. NGOs sector staff, 6,699. Environmental health practitioners, 360. We have also presented the distribution, the breakdown per district. And per district, we can tell you how many staff in terms of clinical and support staff. And we do have a breakdown that we will provide you that talks to all of these categories per district. But maybe to give you grand total, in terms of Amajuba, we will be dealing with about 3,573 staff members, both supportive and clinical. eThekwini, 20,360. Hirikwala, 2,935. The head office of the Department of Health, 1,155. Ilembe, 3,534. King Cetshwayo, 6,227. Ugu, 4,752. Umkungundlovu, 9,093. Mkhanyakude, 4,596. Umzinyathi, 3,635. Uthukela, 3,389. Zululand, 4,395. The total will be 67,644. In terms of identification and prioritization of targeted healthcare workers, a total of 163,256 healthcare personnel from various sectors in KwaZulu-Natal are eligible to receive vaccination during the first phase, as announced by the President. These include 81,000 healthcare workers in the public sector and about 49,000 in the private sector. We've developed a pre-registration system for healthcare workers per facility. In terms of vaccination site, the vaccine will arrive in the province of KwaZulu-Natal on the 14th of February. Staff in direct contact with patients will be prioritized. To date, the province has identified 91 vaccination sites, which will include all public hospitals and community healthcare centers. These hospitals and community healthcare centers will be responsible for the clinics and other sites that are part of the value chain in their catchment areas. In terms of monitoring and evaluation, every vaccinated person will be observed for a while before being discharged after being vaccinated. But also, as we have said that we've developed a register, we will be able to consolidate numbers on each and every day on how many people have been vaccinated. In terms of communication and awareness, as communication and social mobilization strategy has been developed to ensure that all our citizens are well informed about vaccination and the rollout. We will ensure that our communication strategy covers all areas and reach all people who are prioritized for vaccination. When it comes now to the trend analysis, when we move over to the status quo for COVID-19 in KwaZulu-Natal, our province has observed a decline in the number of new cases weekly. The KwaZulu-Natal province is currently the second highest countrywide in terms of laboratory confirmed cases. The overall percentage changed in the number of new cases between week 3 and week 4. When we talk about week 3, it's week 3 of January, week 3 of 2021, and that week 3 is a period between January 17 to January 23. And you compare that week with week 4, and week 4 is the 24th of January to the 30th of January. And the decline between these 2 weeks is about 51%. The actual number of cases was 22,608 for week 3. And for week 4, it was 11,099. Now you will see that decline of about 51%. Over the past week, the highest number of cases received was 2,079, which was on Tuesday, 26 January 2021. The average number of cases recorded daily was 1,777 cases per day. Due to the population size, eThekwini has continued to record the highest number of new cases daily. However, the proportion of daily cases has declined to below 40%. Recently, King Cetshwayo district has been recording the second highest number of cases daily. And in fact, there were days whereby King Cetshwayo recorded more cases than eThekwini district. And that is in particular the 25th and the 29th of January. We saw King Cetshwayo recording more numbers than even eThekwini. We are concerned by the number of deaths reported daily. The actual number of deaths which occurred in week 3 was about 796. And for week 4 was 265. The second wave has been more severe than the first wave in terms of the deaths in the province. The average number of deaths received daily over the past 2 weeks was 75 deaths per day. The analysis was done using the date the person died, not the date of reporting. Within the province, Umkungundlovu district has the highest death rate, followed by eThekwini, Amajuba, and King Cetshwayo. In terms of hospitalization, the number of hospital admission has declined along with decrease in the number of new cases in both public and private sector. This is also in line with the incidence and positivity rate. The number of admissions started increasing steadily from December 1 and then declined from week 3 of 2021. The number of ICU patients has remained constant for the month of January. The province currently has 3,601 patients admitted in both private and public hospitals as at the 31st of January. And private hospitals has about 67% of these 3,601. In terms of actual numbers, patients that are in private hospitals are 2,429, and those that are in public, it's 1,172, and in public it means we have 33%. Of those admitted, 483 patients required intensive care services, and that is 13%. Among those who required intensive care, 44% were being ventilated, and in terms of numbers, that is 211. So that is all in as far as the state of COVID-19 in the province. Let us take this opportunity to update you, colleagues, and the people of our province about the state of readiness for schools opening on the 15th of January. The province of KwaZulu-Natal is ready for the opening of schools on the 15th of February 2021, rather. Our main aim is to have the first lesson during the first hour of the first day of school. This call for readiness in terms of learner admission, availability of physical resources such as classrooms, stationery, textbooks, school furniture, water, sanitization, COVID-19 essentials, learner transport, as well as nutrition, food for learners who are beneficiaries of the National School Nutrition Program. Availability of human resources such as teachers, non-teaching staff are very critical for the opening of schools. In terms of availability of COVID-19 essential for the safety of school communities, this includes the learners, teachers, and non-teaching staff. The Department of Education has made good progress to ensure that all the COVID-19 essentials are delivered to schools before the arrival of learners. This includes the provision of water and sanitization facilities. There is confirmation that all schools will have which have required COVID-19 essentials would have received all that when learners arrive, and this will include cloth, mask for teachers and learners. It must be mentioned that schools are ready as the schools management team opened on the 25th of January. In 2 districts where there has been challenges, those challenges of storage space, and that is provided now by the head office in the province. In terms of learner admissions, out of 2,771,015 learners expected to be admitted by schools in 2021, the province has already admitted 2,769,212 learners, which is the 99.93%. Learner admission has been completed in most of the grades. The unplaced learners are mainly in grade 1 and grade 8. And this is understood because these are entry grades for foundation phase and the secondary school phase. In order to assist parents whose children have not yet been admitted, districts have formed admission committees which will intervene in cases where learners do not find space. The department also expects the walk-ins because of the factors such as the movement of parents from one location to the other. In terms of filling of vacant posts, the department noted as early as 2020 that there are vacant posts created by attrition, retirement, promotion, and even COVID-19 fatalities. These are posts for teachers, departmental heads, deputy principals, cleaners, screeners, and cleaners. There is a good progress in terms of filling of these posts. To strengthen support for school functionality and productivity, office-based posts of circuit managers as well as curriculum specialists have been filled. In terms of surplus, the Department of Education has 3,671 educators and 1,001 of them have been placed. The Department of Education is finalizing the placement of the rest or the remaining 2,670. In terms of infrastructure, there are schools which were vandalized and damaged by storms during holidays. The damage will be dealt with while schools are in operation, except for schools where damage is such that teaching and learning cannot take place. And in such instances, head office is working with districts to ensure that schools are ready for the commencement of teaching and learning on the 15th. Schools will not run short of water because water tankers or water tanks were installed in schools where there is no running water. We must indicate that textbooks and school furniture is also being attended, and this is one of the main requirements for schools to open on the 15th. This includes stationery, textbooks, and school furniture. There is a good progress because the province has already delivered 100% of stationery. As of today, the province has delivered 96.4% of textbooks, and the remaining 3.6 will be delivered during the week ending on the 5th February 2021. In line with the white paper 6, which is inclusive education, the procurement of brilliant textbooks have been concluded and deliveries are ready to take place. Orders for top-up schools furniture were also completed, and 100% of school furniture is in the warehouse ready to be delivered before the 15th. In terms of school nutrition, KwaZulu-Natal has 5,460 schools which are approved for benefiting from the NSNP program. The number of benefiting learners is about 2.4 million. The province is ready to roll out the National School Nutrition Program when schools open this year. However, the Department of Education has directed schools to provide food parcels even before schools open. The province has put in place a system to monitor the percentage of learners provided with food. The central monitoring system will be ready when schools open on the 15th. In terms of learner transportation, for transportation of learners, the province is ready There are 85 contracts comprising of 495 buses, 19 minibuses, and 212 taxis. All these vehicles will be ready on the first day of school opening to transport about 42,000 learners. And for the purpose of COVID-19 compliant trips, there will be a notice displayed in each vehicle about the wearing of mask and compliance. The readiness for teaching and learning. The department has printed all the revised annual teaching plans for grade R to grade 12, and deliveries are underway. Timetable and timetabling under COVID-19 restriction. The timetabling option will not change drastically from the last year's option. Some schools will still need to alternate days so as to accommodate all learners while observing social distance. The timetabling option will include alternating weeks, platooning, alternating days, hybrid model. The choice of the timetabling option will be determined by the demand of classroom space and consumption. Therefore, the province is fully aware of the fact that the majority of schools will not be able to accommodate all learners on the 15th February due to social distancing. With permission from the Minister of Basic Education, the province will communicate the date for staggered return of learners starting from the 15th. In terms of transfer of norms and standards, there is a progress in terms of transfer of norms and standards to schools. The focus is on the transfers such as allocation of textbooks and stationery. For public ordinary schools, Section 20, petty cash, and others. In terms of comprehensive picture, we can say with no hesitation that in KwaZulu-Natal we are ready for schools opening, and we are ready that teaching will take place the first hour, first day of schools opening, as we said. In conclusion, the province of KwaZulu-Natal is ready and wish all learners a successful 2021 academic year. Considerable progress is being made to address minor outstanding issues such as late admission, as we alluded to earlier. School functionality visit will be conducted by oversight committees and departmental officials on the first day of schooling. The province is also ready to implement the first phase of the COVID-19 vaccination rollout plan. We must also emphasize that while we will be allowing school visits, but we will not want anyone who will come outside and then interact closely with educators or learners. We would want to stick on COVID-19 protocols. As we conclude, we wish to advise the people of our province that the special official funeral category 2, as designated by His Excellency President Ramaphosa for Justice Kayelihle Kenneth Mtiane, will take place tomorrow. Justice Mtiane, who served.
All right, the Premier there of KwaZulu-Natal giving us an update with regards to the COVID-19 situation in his province, as well as the vaccine rollout plan and the opening of schools on the 15th of February this year. We will get you the big takeaways in our later bulletin.